Okay, so today's topic of interest is glucosamine. Glucosamine occurs very naturally in the body, in our joints, in our cartilage, in our tissues, and it's also a derivative from shellfish. So supplement wise, it tends to come in two forms, either as glucosamine sulfate or glucosamine hydrochloride. The sulfate version of it is probably better at increasing tissue concentrations and circulating levels in the blood. Studies using that also look more promising, so probably go with that version. What the initial studies thought is that it acted as a substrate for collagen, so they effectively thought it helps synthesize collagen and make your joints stronger in that regard. But what it actually is more likely to do is kind of hinder the degradation of the collagen that's already there, and it does that by kind of interfering with the inflammatory signaling. What that means for us is that it doesn't necessarily promote or reverse any damage, but it can slow it down. Now, most of the research has looked at people with osteoarthritis, and it does appear that you can reduce pain and potentially slow down the progression of osteoarthritis. In terms of the research in athletes, it is a lot more limited. One study in cyclists reduces this biomarker of collagen degradation called CTX2. Another study in footballers also showed the same thing. There was also a study in athletes that had knee problems, and it showed that they can increase their knee mobility and range of motion after 28 days of supplementation. In terms of the overall research, there's undoubtedly a benefit. We just don't know the extent of it yet. Any short-term studies under 4 months, it's very mixed. 4 months and up, you're starting to see more benefit. If we look at a few years, it's a lot more promising. In terms of dosing, most studies will say 300 to 500 milligrams 3 times a day. The effect that you get from it is often dose dependent. It's recommended that you take it whilst you're having food, and it is generally a pretty safe supplement to take. So if you are doing maybe a high impact sport like running, there is potentially a benefit for you there. And that benefit is probably going to be in the way of slowing down any damage that you might do to your joints.